Sorry. Diving back in
Am I sharing?
to our, not sharing.
I need to. It's coming, it's coming.
It's okay.
Good,
Got it.
good. Thank you. Thank you for your patience.
Oh, it was just 60 seconds. I don't even think we need to be thanked for our patience.
Are there any questions based on what we've done so far? A zillion questions.
Oh, so many.
Clarifying questions? No.
Okay,
questions?
I will
Yes.
carry on, but be sure to stop me because things are going to get a little more involved, shall we say. Okay. Okay, now I'm going to talk a bit about the effect of going all the way to the RAND high quality cost of care for reimbursement by CCFAP. So as I mentioned in the previous slide, the actual cost of care for high quality center-based care would be something like $29,650 per child on average in today's dollars, in 2023 dollars. So once again, we're going to assume that CCFAP reimburses the full amount per child up to 150% of FPL, just like in current structure. And again, reminder of those income levels: family of 3, about 46,000, family of 4, 55,500. And then families just above 350% of FPL would pay full cost. So this is where things get a little bit uncomfortable. So above $87,010 for family of 3, or above $105,000 for family of 4, those families would be expected to pay full cost, which remember is almost $30,000, okay? So we are now talking a very high proportion of their income. So I'm going to show you, this is the average cost of high quality care for 0 to 4 plus the 5-year-olds. And I'm going to show you what happens at the 350% level. So here you can see I'm using the same structure for CCFAP up to 350%. So the family contribution stays the same, but just above 350%, no more subsidy. And that family pays full cost, which is equivalent to 34% of their income, which is a very large share, right? And you can see the 10% line is still marked there, quite a bit below the families above 250% of poverty, okay? So that's the situation that we're facing. And so the question is, how do you deal with that sort of picture? And the decision was made by the Senate to continue the eligibility range for families up to about 600% of federal poverty level, okay? So we can explore a little bit their intermediate solution, which would take effect sooner than the ultimate solution, perhaps. So they talked about what they called the middle ground reimbursement amount, which was about halfway between where we are now and where RAND says we need to be for high quality care reimbursement. And so that proposed middle ground turns out to be $24,265 per child per year on average for the 0 to 4 plus some 5s age group, okay? That seems like a very precise number. What happened was that they put forth a number for 2022, which was $23,000. And then we moved that forward to $2023 using an inflation rate, and we got to 24,265. Okay, so the idea is that we'd go about halfway to where the high quality reimbursement rate would be in this first year, and it turns out that that rate is 38.5% above the current CCFAP reimbursement rate. So that's what the Senate has been talking about as a first step going partway to where we wanted to be.
And so I just want to,
Yes.
committee context, because this is sort of a weird thing that we're doing because we don't have a bill in front of us. So we're talking about the RAND study and what's sort of in there for full cost of care. We're talking about the Senate did to understand that there are options other than the RAND study. Likely what we will get from House Human Services is different than what the Senate did, because that's how the House and Senate work. But in either case, the mechanics of this are going to work the same. And so we're using this as a way of understanding the mechanics so we can understand what and how revenue might make sense. Does that make sense?
Yes.
Okay.
Yes, good. And as I talk through this, you'll also see that there are some levers that you all could use in order to make the system either more progressive or more generous or less generous or more costly, less costly, and so forth and so on. So that's why we're going through this exercise right now. Okay, so the Senate decided to start the the Senate decided to start the family payments of $25 per week at a higher level. So they wanted to go up to 185% of the FPL because that is the cutoff for free and reduced lunch. So they wanted to have that same standard apply to the CCFAP program. Okay, so again, this adds to the cost because they're moving that $25 payment per week up an entire income bracket. And that means that forever after, every income bracket is paying $25 less per week. Okay, so they're making the CCFAP program a bit more generous to families, meaning that the cost is a bit greater for the state.
So that's the offset of your zigzag.
It's moving the zigzag to the right. Correct, exactly right. Yes, and I can tell you that provision costs the state about $10 million, moving everybody up by $25 per week. Okay. And the other interesting provision on the Senate side was that they looked at the new curve, the new zigzag sawtooth curve. Some people call it the shark tooth, but anyway, a sawtooth is.
I like sawtooth.
Yes, yes. So in order to avoid that benefits cliff, that sharp increase at the end of the curve, the Senate had to go all the way up to 600% of FPL. So families up to 600%, which is almost 150,000 for a family of three or 180,000 for a family of four, would get some reimbursement. Now, you remember that as you go further up the income scale, the family share gets bigger and bigger and bigger. And by the end, close to 600%, the family's paying almost the entire reimbursement. Okay.
So the question, and maybe you address it later, or maybe it's another witness. As we do this, are we going to have enough slots, space available to accommodate everybody?
Excellent question. Excellent question. It's supply and demand again, right?
Okay.
And the way the Senate thought about it is to say, okay, if we're going to put this new subsidy program in effect in January, this coming January,
Yeah.
we want the childcare centers to be gearing up for more slots, more staff specifically prior to January.
Big leap.
Big leap. So the Senate bill has a provision for what they call readiness payments and grants, right?
Yeah.
Which was 25 million or something. I mean, it was a substantial amount of money. Right. So that would say to providers, we want you to pay your staff higher wages. We want you to hire qualified people at higher wages. And here's some early money so that you can do that prior to January.
Yeah.
Joyce, at that level, what income level is paying the highest percentage of of their income and childcare.
So you're asking to see another chart.
Oh, sorry.
And actually,
Representative.
I should have known there was an answer coming.
so I appreciate that the Senate wants to incentivize centers to staff up for this. Are the human beings who are qualified to do this work available?
Yes, so I can't answer that question definitively, but what I can tell you is that we hear many childcare providers have left the business because they're not paid adequately. And maybe they've gone to
Wait tables.
wait tables.
Yeah.
Or, I mean, in some cases, you would take a $17 McDonald's job over a $17 per hour childcare job because the McDonald's job is easier.
Or $13 an hour childcare.
Yes, yes. So, so we hope that the staff, that the trained childcare staff is out there and that they would want to come back at higher wages. And, benefits would be part of the package in an ideal world. We cannot tell private providers how much to pay their staff. The state cannot tell private providers how much to pay their staff. But given the resources, they want to hire more people, so.
And one more time for Peter, thank you. I guess I would like to have something more definitive than we hope before we move on this bill. And I don't know who would provide, is it, CDD, is it the Department of Labor? Because I know there's been also training programs in place to try to increase that workforce, but if we don't know if that workforce exists, I feel like that's a big concern.
There's been an enormous amount of research on this issue and sort of the problem and the theory of change to solve the problem over the last decade, and we can absolutely have people in to speak to that.
Thank you.
And the theory of the folks who are tasked with solving the policy problem is the Human Services Committee, and we are tasked with finding the money that matches up with the policy problem they're solving. Representative Anthony.
Maybe the train has left the station, but I have to ask, given the kind of leap in amount of money we're talking about, was Rand ever asked whether or not the existing model, which is privately provided, reimbursed by the state, the right model, given the challenges of upgrading, expanding, and the kind of explosion in expenditures that we're talking about? I can imagine other countries do it rather differently.
Oh, absolutely. In Europe, you don't find much private provision. It's mostly public provision. Yes. So what I can say is that RAND has worked with a number of states as a consultant to a number of states, and they have seen firsthand how more state funding leads to more provision of early care and education. It's been true in New Mexico. It's been true in, was it North Dakota, South Dakota, someplace that has fracking revenue, put a lot of money towards childcare, and you can see results. So, I can't speak to all that research except that I've heard about the research that says, yes, pay people more and.
Well, I'm just reflecting on the difference between public education and private childcare.
Yes.
Those are very different models.
Yes, and the RAND report was supporting the mixed delivery system, absolutely. So they would say, yes, you can have some public pre-K, some private pre-K, private 0 to 3 and public pre-K, whatever.
Okay.
Yes.
So the results of the RAND report found in the Dakotas and wherever else you said, New Mexico, those are publicly funded and publicly provided early care centers.
I believe it's a mixed delivery system still,
What
but
is a mixed delivery system?
both public and private provision of early care and education with more substantial public funding going into the mixed delivery system.
Okay. Thank you.
Just, it would be interesting and to ask a future witness how how difficult it is now to hire elementary school teachers. Is there a wait list, or is it, because we would get down into that population if we did upgrade our childcare that much, then that would be the competition. And it would be interesting to know how, maybe there's lots of people who would like to get into elementary education. In the past, well, that's far enough. We could ask somebody.
My understanding is that currently it's a one-way street. You get trained and credentialed in the private early care and education system, and then you move into the public pre-K or kindergarten system in order to get much higher salaries, plus benefits, plus a 10-month work schedule, and no tiny kids who are crying half the day.
Hope they're not crying half the day.
Let's hope they don't cry half the day.
They're very needy. That would be very sad.
Okay. All right, so this table is just meant to show you the numbers all in one place. So you'll notice that my $17,250 current reimbursement CCFAP amount has moved up to $18,199 because I've moved into the 2023 year. So what we're currently providing under CCFAP reimbursement is that $18,000, almost $200. The middle ground would be about $24,000, almost $300. And the high quality average reimbursement from the RAND report would be $29,650. And you can see the ratio 61% moves up to 82%. And then the RAND report would be at the 100%. So that's just to put the numbers in context. Okay, so this chart may answer the question about what happens to people at the 600% level and why did the Senate move to the 600% level. So again, the dark blue line, the top line that goes sawtooth and then sloping down, represents the household size of 3. And the lighter blue line just underneath it represents the household size of 4. And the complication here is that at a given federal poverty level, let's say we're looking at the 500% level. The 500% level under CCFAP has a fixed dollar amount provided by the family, paid for by the family, right? And that fixed dollar amount as a percentage of the FPL 500% family of 3 is bigger than the percentage amount for the FPL 500% family of 4, right? Because you can see underneath the 500% level, the family of 3's 500% income is $124,300. Once you move to a family of 4 at 500%, they're up to $150,000. Yet, CCFAP says that family at 500% has the same weekly payment, whether they have 1 child in care or 2 children in care, because the legislature decided to have a family-based payment for the CCFAP subsidy system.
Or 3 or 4 or 5 children.
Yes.
Family-based.
It might be hard to have 5, all under 5.
Triplets plus, no problem. You did it?
I did it.
Oh.
You better get hot because.
So the family-based is, I would say, based, you were saying where to get on kind of funky math.
Oh, did I move? I didn't really need to move yet. Okay, sorry. Funky math?
Yeah, say 5 and 6 are equal. Or 4 and 5 are equal, but I mean.
Oh, number of, well, so that's the idea that it's the family-based payment, yes.
Family loosely defined, or, I'll be quiet, it's your floor, but.
Yeah, Representative Bodie.
I wonder, what did the Senate talk, are we allowed to ask them? What did the Senate talk about when they talked about that family base? Did they talk about it anything differently?
So there was some limited discussion in the Senate. I think, my thinking has evolved a lot since I started doing these presentations for the Senate, and I think this is the first time that I've actually showed maybe the two-line chart differentiating between the family of 3 and the family of 4. And there are many more questions being asked now by the policy committee, the Human Services Committee, about the family-based payment and what's happening with multiple children and so forth. So this is evolving.
Not our question then.
Nope.
All right,
But it's important for us to understand what impacts
Yes.
costs.
yes,
Yes. Representative Sims and Anthony?
Did you explain the rationale about the family versus?
So I don't think I was part of the conversation when the decision was made, but I can understand that families have a fixed income regardless of how many children they have, presumably. I mean, that's what I'm thinking about. And so as they add the second child, it doesn't mean that they're able
Double
Okay,
their
more.
childcare costs.
Right. So it's also interesting to think, this is going to exercise your brain a little bit more, but when the family of 3, 2 parents, 1 child, becomes a family of 4 with a fixed income, they are moving down the FPL scale. So in fact, their weekly contribution becomes a little bit less. Right?
And also I can add that is not a policy in the bill, that's a policy that passed last year and year before, so that's
It's a CCFAP policy.
exactly.
I mean, the rationale that as you have more kids, you don't necessarily have more income to double your childcare costs resonates with me.
Yes. Okay, good. Are we good with this picture?
Am I correct? What's not said here is there's no differentiation other than income bands as to how many wage earners there are that are receiving that in the family.
That's correct. There has to be at least one who is either working
Right.
or in school.
But if 2 with 1 child and 1 with
Right.
2 childs
This
are.
is their combined family income.
Yeah, I get
Right.
it. It's just, it seems to me the capacity in the family is different if it's a 2 earner family or a 1, but the number of children compensate for the difference in the number
Yes,
of earners.
although you will see if we get there.
Yeah.
At the very end of the slide deck, I do look at the RAND report reporting of the percentage of families where mothers with children 0 to 4 are working, and it's remarkably high. It's
Yeah, I'm sure.
83%, something like this. So,
But not differentiating with that compared to a 2 earner household, even if they bring in the same total dollars, is sort of odd to me, but.
well, I mean, the family income is the family resources
I
that provide.
I hear you.
Right.
It's also, yeah.
Okay. Okay, now this is just a different way of looking at the family contribution and the CCFAP contribution. So we call this the stair-step chart. Some people call it the cross-stitch chart, but in any event, I'm just trying to show you clearly the dollar amount paid by the family matched by the dollar amount paid by CCFAP. So if again, here I'm using the Senate proposal, which goes up to 185% and then starts with the $25 per week. If you wanted to go back to status quo, the lines would move, the family line would move left, right? Because you would start at 150% rather than 85%. But same idea. Okay, so
Should you ask a question? I see on the bottom left, it says child tax credit. What is that referring to on the
Yes.
chart?
yes, so so the child tax credit is $1,000 per child. So this is representing a family with 1 child. And I'm just trying to show that the families who receive no copay childcare would be worse off if they lose the child tax credit because they're not receiving any additional benefit through the childcare bill, but they would be losing the $1,000 tax credit. The same is true for all families across the income spectrum who don't use childcare because they wouldn't be benefiting from a more generous childcare policy, right? but that's $1,000, and you can see, well, I guess I need to tell you that every family above 150% benefits $1,300 per year from the Senate childcare proposal because they're moving that schedule over to the right, which means that every family is paying $25 per week less than they would under current law. Okay, so that's worth $1,300 for them. If they lose the child tax credit, that's $1,000. So many families would on net be, $300 better off. But there are families to be worried about who are not receiving any benefit from this childcare bill, who would lose the $1,000 child tax credit. And those are the families we would worry about. Okay, so this is just another way to look at the CCFAP program. I think we'll move on if that's okay. All right. There were some questions about why go all the way to 600% of FPL, which you'll remember is 180,000 for a family of 4, 150,000 almost for a family of 3. And so I drew the picture just to show what happens if you stop at 500%, which is the proposal in the RAND report. They had some expansion from 350 to 500%. I can't see the top of my screen. Right, so this is using the middle ground, the 24,000 whatever reimbursement rate for CCFAP, and it shows if you stop at 500%, you again have that big spike. So that the family just above 500% would be spending 19.5% of their income on childcare, family of 3. Okay, so that's the picture, and that explains why the Senate moved out to 600%. Remember that chart shows hardly any spike at 600%. Okay, now, this is the 2 children, yes, oh boy. So this is the 2 children in care. Okay, so I've tried to put dots on the lines so that you can see the family, for example, at 300, I think that's 390%, moves down to something like 330% once they become a family of 4. So same income, but they've added a child to their family. And so they've moved down to that lower, I wish I had a pointer. They've moved down to the lower blue dot. Is that it's supposed to be a green dot?
I think your upper dots are green and your lower dots are blue.
Okay, that's a mistake on my part. I want them to both be green so you can follow the green family from being a family of 3 to a family of 4. So that's sort of an interesting case in my mind. I hadn't really thought that through until I did the numbers. So the family contribution is a little bit less if they have 2 children in care, same income, okay? The really interesting case in my mind is the red family, the dark red family. So with 1 child, 2 parents, 1 child, they're a household size of 3 and they're at 700% of the FPL. So they're paying full freight for both children. That's the.
If you move your cursor on the screen, we can see it.
Can you say, ooh.
Sorry, I didn't see
nice.
that earlier.
Thank you. Yes, I'm talking about the family at 700% with 1 child, 2 adults. And then they have their 2nd child and they move just below the 600% level, which means they qualify for help with CCFAP reimbursements. And so now their family contribution is substantially less. They're at something like, 12.5% contribution instead of up here where they were at 26%.
7, yeah.
Yeah. And that's where crossing the line makes such a big difference.
This is an attempt to solve our demographic challenge in Vermont by incentivizing additional children.
Very, very astute. In fact,
Let's get on it.
Jeez. That's my wife.
yes, if Vermont wants more children, this might be a way to get there. So, okay, it's what happens under the current policy. Okay. So, and the other thing I wanted to note is that the family of 3, so the single parent with 2 children would end up paying 32.5% of his or her income for childcare. The family of 4 with 2 children would end up paying 27% of their income for childcare with 2 children, just above 600% of poverty.
Okay, so this,
Again, you can see this is well above the 10% goal that the legislature set for itself. Okay, so that was a fun chart to do as well. All right, and we actually did make it. This is great. Okay, so here we have some numbers, and this is sort of the compilation of numbers that I needed to have at my fingertips as I was thinking about the issue. And so at the top, we have actual, we have actual CCFAP enrollment numbers, 0 to 4. So infants between 0 and 350% of FPL, we have about 1,000. We have 800 toddlers and about 2,700 pre-K students, meaning we've got 4,500 children, 0 to 4, plus before kindergarten, enrolled in CCFAP. And the budget currently is $62.75 million. Okay? On the right-hand side, you've seen these numbers before. This is the survey that says how many children would you have at your facility? And again, we add up to about 17,000 based on the provider data from that survey. JFO then had to estimate under the Senate bill, extending the benefit to 600% of the FPL and making the benefit a little bit more generous by $25 a week for everybody in CCFAP. What would be the enrollment? And so we did some hard thinking and some matching up with FPL levels and how many children are where and so forth. And we came up with an increase of about 2,900 students added to a base, which we called about 4,800. So, I'm sorry, I'm getting mixed up. So 0 to 350, we said an increase would be about 2,900. Then we had to estimate the increase 350 to 600%, right? And that number is 4,800. So we are estimating a total increase once everything is in place. We're not saying this is going to happen on January 1st, 2024. But once the system is set to go, an increase of about 7,700 students enrolled in CCFAP, which means 171% overall increase. So that is substantial, no doubt about that. Now, not all of that is new caseload to providers, because of course, many of those families, 350 to 600%, are already enrolled in a early care and education program. So some would move from, okay, we're paying entirely by ourselves for this 17,000 whatever dollar bill to we're getting some CCFAP help for the $24,000 bill, moving those reimbursement rates up 38%. Okay, so we are saying that the combined overall CCFAP caseload would be about 12,200 if our estimates are in the right ballpark. I wanted to put these notes.
Do you have a question?
In a
Sorry,
place.
1 second.
Oh, sorry.
The 12,200 is you mean number of additional families?
No, that's existing caseload plus the new caseload that we are estimating. So remember, it was 4,500 up above, existing caseload.
And then
And then we're adding 7,700. So the total would be 12,000.
So 7,700 is the
New
new,
caseload,
which is kids or families?
kids.
Kids. How does that work out if family-wise stuff? Probably
Right.
doesn't
So
matter.
then we have to estimate how many are second, third children would be full cost to CCFAP, right? And that differs by, well, partly it differs by where they are in the income scale. Yeah.
Right, you're glad that Joyce and Ellen are putting that
We have JFO.
I
Representative
know I'm
voting.
missing something. I know I am.
Okay.
I know you have been explaining everything really well, so I'm sorry, but you have the 2,900 children at 0 to 350%. The more that increase of 4,800 to the base, that's because getting us to 7,700, no,
Well,
12,200.
Well, it comes from, so those are the children from families with income 350 to 600%. That's the big new expansion in eligibility.
I started to think that, but wasn't sure.
Right.
But do we know?
No, we don't know anything.
That's the raw numbers of those kids, but.
No, it's not the raw numbers.
These are just the kids who are in childcare now.
So the kids who are in childcare and in CCFAP now are the 4,500.
Okay.
Will you point with your cursor?
Oh, fingers didn't quite work. There it is. Those are currently enrolled in CCFAP, 0 to 350%. Yep. Well, last fall, yes.
Okay.
Yes. And then if there were more slots, meaning more staff, more providers, and so it's sort of interesting. Right now, the number 300% to 350% really tails off. There are many fewer children from families in those upper income groups, 350%. And we've been told that families don't bother to apply if they're not going to get very much because the application is 17 pages long and takes a lot of work. But if the tuition goes up by 38.5%, it might become worth their while to apply. And if slots are available, they might apply to be part of the system. So that's why we're projecting this expansion of 2,900 more CCFAP slots, 0 to 350.
I've almost got this, but that you get to 4,800 if you make the application easier and the benefit better.
No. So the 4,800 comes from families who right now are not eligible for CCFAP. They're above the income cutoff. Right? So they may be in childcare, they may be using a relative, whatever. They're out there. We know many parents are working, but these families would become eligible for CCFAP. They would have to complete the application and find a slot. So if there are more slots available and more families applying, we're projecting to 4,800 additional children in that income.
And then the 7,700 is what?
7,700 is just adding together the 2,900 expansion from 0 to 350, or more children in that income bracket. And then the expansion of eligibility to the 350 to 600 families.
Brings you from 77 to 12.2. It doesn't add another 12.2.
So the 7,700 is JFO's projection of children newly enrolled in CCFAP under this new program. Add that to the 4,500 existing children in CCFAP. And you get 12,200.
All right.
So the 7,700 does not include new babies that are not born yet. Because we were talking about how to increase the population. We're not including those kids.
Okay. So certainly the 4,500 is based on actual kids in care. And those kids every month are moving up through the system. And every month there are more babies born who are moving up through the system, right? So the idea is that in the next year, there won't be big differences in numbers of children in 0, 1, 2, 3, 4. There won't be in the next year. I mean, there could be some small differences, but we're not expecting huge differences.
Yeah.
If everybody starts having second, third, fourth children, then we're in trouble, right?
My other question is, how do we know about capacity, about new centers' ability, the ability of new centers to open, to take care of these kids?
Yes, so that's probably a better CDD question because they have capacity grants that help, technical assistance, loans and so forth, that help centers that want to open. So that is probably a CDD question. They are already in the business of helping new centers open, and you'll notice a substantial, what is it, $6 million in administrative funds newly part of the Senate bill in order to beef up their staffing so that they can help more centers open, more parents apply, all of that. It's going to take a lot of work. Yes.
Thank you.
Joyce, my recollection, correct me if I'm wrong, that the RAND did include a discussion of the effect this kind of expansion might have on labor force participation.
Absolutely, they sure did.
And consequently, income expansion that heretofore was not paid work. And so it wasn't counted, wasn't taxable, et cetera, et cetera.
Absolutely.
Okay.
Yes, and that was the last chapter of the RAND report, and they did their own macroeconomic analysis. They had a nice model. They found not a huge increase in the overall workforce because so many parents are already in the workforce, and we're going to look at those numbers.
Okay,
next.
thanks.
But there is some expansion, certainly, and that does contribute to additional revenues for the state and additional GDP, economic activity for the state as well.
Well, I would also think that if you're going to correct the poor payment of practitioners in the system and almost double in some cases that as well, even if the participation rate doesn't change.
Absolutely. And that was part of their model as well.
Yep.
Yes. And then that gets spent and the multiplier works and all those things you remember from your economics. Yes.
Representative Meadows and then.
Joyce, I don't know if it has any bearing on the numbers up above, but the RAND report, little note down there at the bottom, it says 60% are under 350, 81% between 350 and 5, and 19% above 5. Isn't that 160% of children?
No, I'm sorry. I could have written this differently. Oh, I did write it incorrectly. You are absolutely right. I need to change that wording. Yes, are under 500%.
Oh, okay.
No, you're absolutely right.
Okay.
Yes, or I could write that 21% are between 350 and 500%.
Okay.
You're absolutely right. Yes. And I've read this, at least 20 times and I haven't noticed it. Thank you. Thank you.
I feel like Kurt.
Yeah, it was like you were channeling.
Got a star for the day. Yes. Yes, absolutely. And I did want to highlight those numbers. The RAND folks looked at the American Community Survey between 2015 and 2019. It's interesting, Vermont is such a small state that when you're looking at small groups of populations, you can't just look at 1 year because we survey, 3% of the population, which is tiny in Vermont. So you have to combine 5 years worth of data. And then you get this result that 60% of children ages 0 to 4 or, less than kindergarten are under 350% of FPL. 81% are under 500% FPL, okay? And only 19% are above 500%. So now people are asking, well, what about above 600% of FPL if that's the new cutoff? And I have to say, I don't have the exact numbers. My guess is something like 15%, but I don't have the exact numbers. Okay, and very last at the bottom of this slide, I found it interesting to think about the total number of kids and working parents. So if we look at all kids in Vermont as of, this includes 2022. So as of 2022, we have about 27,500 children ages 0 to 4. And again, I'm thinking, okay, if you're thinking childcare, you can take off the first, 2 or 3 months and then add on a few more 5-year-olds, 2 or 3 months. Okay, so 27,500 children. According to RAND, based on that survey, 2015 to 2019, the labor force participation rate among all parents, well, maybe I was mixing up all parents and mothers. Okay, all parents is 84%. So 84% of children have parents in the workforce, among all parents with at least one preschool child. Okay.
Know whether that's
Go ahead, Carol.
one parent or two parents?
Among all parents, right, so, right, I don't know, among single parent families, that's gonna be a different number. Yeah, that's right. I don't know the answer to that. And I don't know if they do. I don't know if the sample size is big enough to give us a significant.
Joyce, isn't usually when sort of the idea of all parents in the workforce, it includes, it's either
Both parents are.
if it's a 3-parent family, it's 3 parents in the workforce. If it's a 1-parent family, it's 1 parent in the workforce, but it means the same thing. Like all parents would be inclusive of single-parent families and multiple parent families.
Yes, so this would say 84% of children in families with at least one preschool child have all parents in the workforce. Did I say that correctly?
Yeah, or we could say 19% of.
16%.
Thank you. Thank you for that math. 16% of families have one parent who is
Not in the workforce.
Not in the workforce.
Yes.
Okay.
And whether that's a single parent or a
Don't know.
one of two, we don't know. Yes. Among mothers, 78.7%. 78.7% of mothers with at least one preschool child are in the workforce. Less than 350%, it's a bit less, 77.6% of all parents are in the workforce. And over 350%, it's 92.6% all parents in the workforce. So then if I take that percentage and I multiply it by the total number of 0 to 4, which is 27,500, I get potential early care and education need ranging from 21,000 to 25,000, right?
How do you reconcile that number with the 12,200? That's what I'm sort of hung up.
So we haven't talked about informal care, but there are many families that use a grandparent or a neighbor, or they share a nanny, or they use nannies. There are various, or they have offsetting work schedules, right? The father works some hours, the mother works other hours. So there are many other arrangements.
So are they making it work out of necessity? Or are they making it work out of choice?
What is a
or
necessity under capitalism?
Well, I know, that's kind of what I just look at these and that's what I get hung up on. Are we gonna bring more children into the system and more folks into the workforce if this is available, or what's gonna happen?
What I can tell you.
I'm asking you to look through a crystal ball, but I just feel like we need to have that.
What I can tell you is that Rand used 80%. 80% of children with parents in the workforce or in school or whatever would need some sort of formal care, right? So that was their approach. Other people might use a different approach.
But 80% is very different from that nexus between.
Absolutely. Absolutely.
Yeah.
Which points to the need for more childcare capacity. Yes, absolutely.
And which sort of suggests that a lot of those families out there are just doing whatever they can to piece things together and make things work without the system.
Absolutely
It's
true.
either not available to them or it doesn't work for them or.
Or they're working part-time. Remember that part-time parents would count as being in the workforce.
Yeah. Thank you.
If you would like just a case study to help my thing. When we had our first, I could not find infant care until my kid was 6 months, because all the places I called, because there are very few infant slots. And so we're not fully employed in the workforce, and I found a part-time slot, and I was limited to part-time hours because that's all I could find. And then when we had 2 kids, could not, and I drove 45 minutes for the slot that I got that was part-time.
Yeah.
And then when we had 2 kids, again, there's no infant care under 18 months in my area. With support from family, was able to access a nanny to provide very expensive care to my kids. And the minute that I got a slot and my kids turned 18 months, they were, able to go there. And so we absolutely just patched it together, and had there been a high quality childcare program nearby with full day slots, could have been employed more and less financially constrained than we were during those times. And
not losing money towards retirement and social security and
wage growth.
Wage growth, like all of, that's, and we talked about that even in the context of medical leave. Okay, I'm gonna move us?
I think I'm at the thank you slide unless there are, no, I'm at this slide, but you've seen this before, so now I'm at the thank you slide. So thank you, this has been a very good discussion and I'm happy to answer questions as they arise. Yeah. Good?
Thank you. Yes.
Yeah.
Very helpful.
Yes.
And you are coming back tomorrow to talk more?
If I'm needed, yes,
Okay,
I can be
great.
here tomorrow.
Okay.
Yes, absolutely.
So next up, Julia, does 40 minutes feel 30? Okay, great. So as we discussed previously, the system is divided into two separate systems managed by two separate agencies with two separate funding sources. And so Julia's going to cover the pre-K part.
Good morning. For the record, I'm Julia Richter with JFO. I don't know, Madam Chair, how you would like to proceed. I did hear that there were some questions that I would be able to answer during Joyce's testimony. Would you like me to kick off?
Yeah, sure.
that? Okay.
Great.
So I think I heard 3 questions, and so I'll just go through them. I'm happy to talk in any more detail if I did miss any questions. The first question was, I think, to Representative Beck regarding those pre-K expenditures. You'll remember that Joyce was talking about approximately 62 million in the ed fund of pre-K expenditures. And the question was if that is public and private. So remember that there's the option of sending your child to a public program in a public school setting, or those tuition dollars to a private provider. And the answer is yes, that 62 million approximately encompasses all pre-K expenditures, or expenditures that are booked as pre-K expenditures in AOE. So it's the data that's coded to pre-K expenditures. In FY22, that number was 64 million of pre-K expenditures. In FY21, it was 58 million. And then I thought it would be helpful for the committee just to think about how that's broken out. So when looking at how those dollars were booked in AOE pre-K data, 53% was for personal services and salaries. 20.
Is this written down somewhere?
I can certainly share my screen if that would be helpful. I was taking notes while the committee was talking, so I don't have a nice slide deck to respond to the questions that were asked.
They're just questions that came up this morning. And then you have a presentation.
I do have a
presentation you're going to share with us after. Yes. Yeah.
So I'm just going to get into the Zoom and then I can pull up.
And it's okay to just like take 60 seconds to get on the Zoom. Everyone always feels very rushed about that part. It's okay.
All right.
You don't need to feel frantic about it. We can just.
All right. Thanks.
Just sit here. Having a minute to sit here is actually kind of
Very nice.
Yeah, it's very good.
We'll stop staring at you.
It's okay. All right, so. All right, so I'm just gonna show you, starting to share my screen now. And just trying to show you, okay. So forgive the spreadsheet, but what I've got highlighted here is what I was just talking about. So it's easier to see what I'm talking about. So this is looking at the FY22 dollars of pre-K expenditures. So AOE shared with us data of those dollars that are booked as pre-K expenditures in their data collecting system. So this is what I was just talking about, that of those about 64 million, 53% can be considered to salaries, 20% is to other purchased services, and 19% is to benefits. So together, that's 93% of pre-K expenditures are really those people costs primarily. So that's really what I just wanted to talk to with respect to the earlier question.
I have a question.
Purchased property services. What is that?
Yeah, so that's a great question. And that's why I was initially hesitant to pull up this table without any cleaning of it, because you're seeing a lot of data and normally we piece out the bigger picture. So you see of the 63 million, property is 74,000. So that's really in the whole scheme of pre-K expenditures, really just a drop in the bucket. I would have to get back to you about what is being counted as that, but it rounds to 0%.
Well, I was gonna ask you to send the whole thing to Sorsha, but maybe I won't because there's too much stuff that's.
I think there's a lot of weeds here that we're really looking now at the nitty gritty. When we take a step back and we just look at the percentages, we really see that these bottom percentages are really not making up much of that pre-K expenditure total.
Okay, thank you.
I'm wondering about the other purchased services.
So I would have to get back to you as to how that's broken up. This is AOE data that they've got the budget data and they can pull out pieces. So this is pulled out. It's important also to keep in mind when we're looking at this data that it's been coded, it's different school district budgets. So it might not be coded in the same way. So that's why it's often helpful to think in terms of percentages and big picture, because when we really dial down into the minutia of the data, we might be losing the bigger picture.
But the assumption is that other purchase services is part of personnel.
I think that is a fair assumption, and I would want to get more clarity before speaking to that category in more detail.
Oh, sorry.
No, I was gonna say, I'd expect that number to go up if they actually allocated space to the cost. Because just space for the classrooms isn't zero. And I wouldn't imagine it's 74,000 either for property. So I'd imagine it'd be quite a bit higher if they allocated it based on space for those classrooms in the school, right?
Yeah, I think that's one of the challenges of looking at what specifically is being booked as pre-K. Like maybe some school districts are coding part of that overhead, maybe some school districts aren't. So that's when we're thinking about how many dollars are currently in the ed fund of pre-K dollars. We're using this 62, 64, 58 million picture. But in reality, and this is what I will talk to more when I get to my prepared remarks, there are some big data constraints when understanding what is happening in the pre-K space in the education fund. So everything I'm talking about here has that really big caveat of data constraints and a lot of different things happening in different districts. So that was just the first question that I overheard I wanted to speak to. The others, I think, will be less weedy. I just wanted to confirm, I think Representative Sims did confirm this, but the question was, can you be in a send your kid to a public pre-K program and then also receive those tuition dollars, send them to a private program for more hours? No, you choose where your child is going for that at pre-K. And then the last question was about EEE, essential early education. That was categorical aid or federal funding. That is categorical aid. So when we look at the education fund outlook, which we were looking at in all of those yield discussions, that's one of those line items in appropriations.
So do we get reimbursed for that?
No, so that's a categorical aid. So that's coming out of the statewide education fund, statewide education fund dollars. All right, were there any other questions that are still percolating before getting into prepared remarks? Okay. Madam Chair, would you like me to just
That would
start
be
on
great if you could jump.
presentation? Okay.
But I just noticed the RAND report is on here.
Yes,
Thank you.
yes.
Thank you.
Thanks, Risha, but yes.
All right, so we're moving away from Joyce's testimony in part because we're now thinking about the public pre-K and the education fund. And we did talk about this last week, so I just have a couple of reminders of what we spoke about, follow up to one of your questions, and then talking about moving forward, what potential costs may look like. So big picture, just recalling that current pre-K expenditures are in the education fund. And this is that 64 million that we were just talking about. I also wanted to remind the committee that public pre-K expenditures really vary widely by district. So for the data that we have available in FY22, those per pre-K pupil expenditures ranged from about 4,300 to 21,000 per pre-K pupil across districts. And that's what we were talking about last time, but that just to have that idea in the back of our mind of what is that range. We also spoke about how pre-K expenditures really vary by district. So this is what we were just talking about. And really that the costs and offerings are school district decisions and parent decisions. So some school districts offer full day pre-K programs, others do not. Many offer maybe something in the middle, as we're about to see. And while school districts vary in their offerings, so too do parent decisions. So just because a school district decides to offer however many hours of a public pre-K program doesn't mean that the parent needs to send their child to that pre-K program. So the committee asked about this last week, and I got some data from AOE. I could make that a little bit bigger.
Awesome.
Yeah, so AOE conducted an informal survey of what are school districts offering for their public programs.
Can we repeat the informal survey part of this table?
Yes.
Okay.
So that's what I was just going to get into. So this should be interpreted with a really big caveat. This was an email that was sent out to business managers trying to understand what different school districts are offering. So while this can give us some sense of what is happening in school districts, it should certainly not be interpreted as comprehensive because it was informal and because not all school districts answered and because we haven't spent a lot of time really digging into this. This is just a compilation of survey responses, however the business managers interpreted the questions. So with those big caveats in the back of our minds, we can look at some of those results from that informal survey. So what we're looking at here is the maximum hours per week of public pre-K that's offered by a school district. So this is not touching at all kids or hours for private programs. This is just looking at what the school district is offering. So the way we can read this histogram is we've got on the x-axis, our bins are the maximum hours per week of public pre-K that's offered by the school district. And the y-axis is counting the number of school districts that responded within that bin. So this first column is 0 to 4 maximum hours per week of public pre-K that's offered by the school district. So 25 school districts, business managers reported that their school district offered 4 or fewer per week hours in their public school setting. 0 reported between 4 and 8, 11 reported between 8 and 11, and so on. We can read up through the chart. And because this is an informal survey, we can't, it would be irresponsible, I think, to use this data to try to pull really big estimates or try to understand the pre-K expenditures, because we're looking at survey results here. So this is just to form a picture.
Representative Tim Rose, Sims, Brannigan, Odie.
Julia, do we do any sort of equalization within pre-K students? We do the same weights that we have in the rest of the system, or is that weightless?
Yes, so great question. So this goes back to some of the committee's discussion last week. So we'll recall that there's the 0.46 weight for pre-K students under current law. With the changes to pre-K weights, it's moving to a minus 0.54, but mathematically that's the same. So this, what we're looking at here in this histogram, doesn't touch at all pre-K weights. All pre-K students receive the same weight regardless of offerings. So looking at this, these 25 school districts who are offering 0 to 4 hours are receiving the same pre-K weight for their pre-K students as these 12 school districts who are offering 34 to 38 hours.
But there's no other weighting within that amount per student. There's no weighting for poverty or for rural areas or for any of the other sorts of weights that we apply across the rest of the system.
So under current law, and this gets very weedy, but under current law, the way that the weights are structured, it's a multiplicative approach. So there's more of a relationship between the two. As we move into the new weights, which kick in FY25, the pre-K student will receive the negative weight for their pre-K age. But if that student were to fall into any of the other weighting categories, that weight would still apply to that student.
And just going back to the 4,300 versus 21,000 per pre-K pupil. I'm still really wondering what's going on there and why those numbers are so all over the place. And I'm assuming that's based on they're getting the same level of service, right? Or not, or that some of it is part day, some of it is full day, some of it is
10 hours.
Yeah, so there's a lot at play. And unfortunately, we don't have the data where I can point to and I can say, this is impacting it this much and this is impacting it that much. Some of the factors that may be impacting it are the hours, so the offerings. We're looking at a large discrepancy of offerings here. We can also think about, for instance, special education expenditures, certain pre-K students who are also receiving a special education or an individual education plan that may impact the level of pre-K expenditures. The services that are provided within the pre-K program, within the certain number of hours. So there's just a lot of variance, both within the student population as well as the offering.
Okay. All right, thanks for that reminder.
My question was, these decisions, how many hours are made by the local district?
Correct.
Is that true?
Yes.
Okay.
So the pre-K, that's correct. And the pre-K expenditure that are included in the school district budget, that's being determined by the school district. And then that's just part of the whole budgeting process where the school district builds its budget, then gives it to the local voters to approve that budget.
Everybody gets the same amount of money regardless of how many hours, right?
No, not necessarily. So everyone receives the same level of taxing capacity for their pre-K students. That's that weight. But the amount of dollars is determined by the school district, built into its budget. and then drawn from the education fund. So that's that variance of pre-K expenditures by school district. That's the school district pulling the funds from the education fund. Now, depending on how many pre-K students they have or don't have, that's impacting their tax capacity. So that's impacting how their local tax rates are adjusting because of how much they're drawing from the ed fund.
Thank you.
My question was just sort of, do you have a sense of how similar this array is compared to the chart that you showed us before with the per pupil spending? It seems like it's, I mean, again, I hear this is just a random sort of sampling size, but it seems sort of similar.
Yeah, I was trying to think about if there was some way to, combine the data sets. But just because of the very different data set and not being able to parse out who's private, how many kids are going to private, and not having very different data sets, I can't speak to that.
It seemed like we're able to say there's a wide variety in a number of hours that are offered, and there's a wide variety in cost of care or cost per pupil, and that may be, that may explain a fair amount of the wide variety of costs because people are funding staff working really different number of hours.
I was going to ask if it would help you to make a mandatory answer for these things, but it sounds as though there's so many variables, I'm not sure what that would really do for us.
Once upon a time, there was a project to create a standardized accounting system that all school districts participated in, but that seems to have failed terribly. And so we are back at square one with this mediocre data that our team and AOE makes the best of.
I've wanted that since the 1990s.
But what else can you tell us about pre-K given what we know?
Yeah, so that wraps up my my remarks on this. Before moving into the next slide, I was asked to estimate based on the language in H208 what would be the potential cost if we were to move forward with 4-year-olds in public pre-K. So similar to kindergarten, providing that public pre-K full day pre-K option for 4-year-olds. And it's important to interpret this estimate with a number of caveats, which I will talk about, but I also know that the committee is well aware. So we estimate that expanding public pre-K program for 4-year-olds as outlined in H208 will cost an additional approximately $40 million to the education fund. So this is netting out that 62 million that's of pre-K expenditures that already exist within the education fund. So this is that 40 million additional. And as the committee is well aware, if this were to happen, absent any other changes in policy, the base homestead yield and or the base non-homestead tax rate would need to be adjusted.
Is that, how does that relate to CCFAP? So some of that 40 million, is that 40 million all new money needed or some of that already being some portion of it funded by CCFAP?
So that's a great question. This is only talking about, and I will get into like how to think about this number, what it does and does not include. But this is only including the estimated cost to the education fund for this public program. So this is not touching on additional potential fiscal impacts to CCFAP, which would need to be made, changes that would need to be made, impacts to other sectors, impacts to other programs.
Yeah, I guess my question is, are we already paying for some of this care as a CCFAP subsidy, and this would be shifting some of that to the ed fund in lieu of CCFAP? Does that make sense?
Yeah, so I will certainly let Joyce and or Nolan speak to that. And I'm only talking about what the cost would be to the education fund.
And so like, in talking to folks who sort of have, and working on various bills that have included this, the idea is that right now, a very uneven amount of pre-K dollars is spent on pre-K, right? Like very different from each district. We've talked about that. So by having 4-year-olds be sort of officially under a full day pre-K program, it would create sort of equity between districts where some, right? And it would reduce the amount that would need to be raised in CCFAP, because CCFAP would be for birth to 3 plus all the after school stuff that we haven't really talked about yet and won't right now. So, but it's not 1-to-1, the math.
Correct.
But yes, I think is the answer to your question. Yeah.
So I appreciate that this slide does not address shifting costs from private to public. Would it even be realistic to think we could understand how much money would be shifted out of private programs with this? Just understanding it's complicated, right?
Yeah, so this is really complicated, and I do want to walk through just the caveats of the estimate, because I think that it's really important to keep in mind that this is an estimate that could significantly change with a number of changes. And I will, again, refer to Joyce and Nolan to talk about the CCFAP changes. And I can certainly talk about how we have estimated this number. And given the data that we have available, I'm not sure if we can further estimate.
And there is no policy proposal on the table to do this next year. To like move to full day pre-K next year. Like that's not one of the policy proposals on the table. It's like part of the mix of a long-term plan on how to think about how these costs are sort of divided amongst departments and programs and parents experience them and how they're covered by the tax base. So also want to put that caveat in to the pile of caveats.
Yes.
That's my political caveat to Julia's accounting caveats.
Great. So thank you. And there may be other caveats that when I was putting this together, I didn't think to include in this bulleted list, but some of the things that we need to keep in mind are there may be likely will be required facility renovation and construction needs. And we don't know what those will cost. We do have the school construction task force bill, which passed out of the House, is being considered in the Senate. There's also those PCB remediation dollars. So that question mark of facility needs, facility availability, what that may cost in addition to the 40 million is not included here. There are significant data constraints, as we've been speaking about in this committee. So if better data were available, then we may have a better understanding of the potential cost. The estimate also assumes current spending patterns. So the estimate was calculated using the current levels of education spending per equalized pupil by district. It also uses the current pre-K expenditures by netting out what's currently being spent in the ed fund that's being booked as pre-K. So with any change in current spending patterns, of course, that too would change the estimate. And lastly, ultimately, we have a statewide education fund where the expenditures are really driven by local spending decisions. So depending on how local school districts would decide how much they would decide that they needed to spend on this expansion of public pre-K, that too could very significantly impact our estimate. And then getting back to the question of the fiscal impact of public pre-K on other programs or sectors, that this estimate is not speaking to savings nor additional costs outside of the education fund and the public pre-K space.
Yeah.
My recollection from Joyce's presentation was the source of funds she was talking about were 100% state. And my understanding in the ed fund is it's a mix. There's some federal funds and state funds, or am I wrong about that?
So this is speaking solely to state funds.
Okay.
So I did check with AOE and there's not any specific federal funds that are in the education fund, flowing through the education fund for just pre-K in general. There's the special education
That's what I was
funds and
thinking.
the meals funds that Joyce was speaking to. But this is talking about 40 million in the statewide fund.
So the special ed is insignificant enough not to even talk about in relation to the total need.
I think that it's more, those federal funds won't impact this estimate.
Okay, yeah, thanks.
So that is, I think, yeah, that's everything I had prepared. I'm happy to talk in more detail about the estimate or any questions.
Can you, I'm trying to parse out what is coming out of the ed fund and what's coming out of CFAP. If a school district is offering pre-K and they have 10 students and they factor that into their budget, and then that's going to come out of the education fund according to the weighting formula for those students, correct? Now, how does the CCFAP get involved in that? That's if a parent wants to, I don't know exactly how that works in there.
I'll let Joyce speak to CCFAP. She's really the expert on that. That's okay.
Sure. So Joyce Manchester, DAPO. So my understanding is that if a child is enrolled in universal pre-K, let's say, for example, it's 5 days a week, 3 hours a day. Okay, so mornings, universal pre-K. And if the parents work full-time, they obviously need afternoon care, right? So the afternoon care, maybe there's an after-school program at the public school that's offering the public pre-K. And that after-school program would enable the parent to apply for after-school CCFAP. And I don't know how they would term it, if they would term it part-time preschool CCFAP reimbursement, or if they would designate it as part of the after-school. I guess they'd have to do part-time preschool, because the ratio is still different from older dips, right? Ratio of students to teachers. On the other hand, if there is no after-school program for those morning kindergarten kids, morning pre-K kids, maybe they transport the child to a private early care and education provider. And again, they could apply for CCFAP funds to help pay for that afternoon care at the private provider. So yes, they could apply for CCFAP.
So the CCFAP is is another funding stream that comes in separate from what's coming out of the education fund for the publicly supported, the public schools pre-K program.
Well, no, it would not cover the morning, because the morning is covered by the public funding.
By the ed fund.
That's right.
Okay, so
it'd be the other hours.
if they want more than that, then they would apply separately through CCFAP and get, based on their income and size, what they would get reimbursed. Or does that go directly to the parent or to the daycare, the child care?
CCFAP payment goes directly to the provider.
Okay.
And the parent would pay their family share to the provider.
I see. All right, I got it.
Now, the interesting thing is, how many public schools are going to have the after-school availability? And would the private providers provide just afternoon care for preschoolers if they're all in the public school during the morning, right? There's so many questions. And of course, we haven't talked about what happens to the private provision of early care and education if you pull out 3 and 4-year-olds who right now are subsidizing the infants and toddlers, right? So that's another huge issue.
So we need to wrap up. So Representative Sims, you can have the last word. And this is not the last word on this topic. We are gonna talk about this tomorrow morning again, so take notes.
Really good one.
Oh, good.
Yeah, for sure. Yeah. I
Sorry to keep
this late.
chiming in with personal anecdotes, but like, I've been living and breathing this for the last 5 years of my kids. And just to the point Joyce was making, I know that the center my kids used to offer afternoon slots to kids who went to their 10 hours at their local elementary school and then stopped offering that because it was impossible to fully fill their slots because you'd have to find other, students who just wanted the morning to leave, and it limited the financial viability of the center to just be the kind of afternoon slot. And so I think that piece about how all these various programs fit together and complement each other. I mean, I have certain high value students that drive up other slots, and just the other thing that I've heard from my community about shifting all UPK full day to school facilities is like, is there space at those facilities to accommodate all the kids? And I know that my own elementary school is looking at a $35 million new construction to just accommodate the growth in student population that we have in our community right now, not factoring in a significant growth in 4 and up. So I think these are such important questions that we're having about how do all the pieces work together in a way that's complementary and meets the needs of all of our communities and supports our centers and doesn't overwhelm our school system, public school system. But we'll solve it.
And with that, so we are back here at 2:30. So if the floor ends before that, we are still not back in here until 2:30.